Hi, this is Nicola from Kids Eye Gear, and I'm really excited today to be having a chat with Natalie Ainscough from Adelaide Orthoptics. Natalie is an orthoptist and is going to share a little bit of information with us about what an orthoptist is and how they can play an important role in a child's vision journey. Welcome, Natalie.
Hi, thank you so much for having me today. I really appreciate it.
You're very welcome. So first up, we might just start with a little bit of an explanation as to what an orthoptist is and what role the orthoptist might play for a child's vision in particular.
It's a great question because it's one that as an orthoptist I've heard my entire career, pretty much since I chose a university course at the University of Liverpool all the way back in 2005. So an orthoptist in the simplest sense is an allied health professional. So what does that mean? We're not a doctor, we're not a nurse. We fit within the ancillary health professionals, and we specifically train in the area, obviously, of eyes. But that's where you start to pick apart the orthoptic role. An orthoptist role is not just about pediatrics, squint, or amblyopia. That's definitely one really interesting subtype, but there's orthoptists who work mainly in cataracts, in glaucoma, outreach work. We've got orthoptists who specialise in managing eye practices and eye hospitals. So think of orthoptics, I like to say, the jack of all trades in the eye world. We can do a little bit of everything, and we work really hand in hand with ophthalmologists and optometrists that we work with and around, purely because we want to be able to help our patients the most. And that means, although we're trained to do one very particular test, maybe at university, later on we learn to do other things, including patient counselling. I spend a lot of time supporting patients and guiding patients. And we also have a lot of orthoptists nowadays going into the world of NDIS and what that means for our patients. So think of us as an overarching eye health professional who can do a little bit of everything, but is not taking on those roles as nurses or doctors.
Perfect. Can you tell us about maybe one or two specific tests, which you did mention before, that you might conduct during a child's vision exam?
Absolutely. So I spend probably 80% of my time working with children. So that's kind of my, I suppose, if you have an area of expertise, it's one of mine. And two of the tests that I do all the time and are really, really key to what we do are visual acuity, which is a fancy way of saying vision testing. And another key one would be cover testing, which is a fancy way of saying what position is the eye in, what is it doing, and what does it want to do. So if I'm doing a vision test with a child, the first thing I'm going to think is, how old are they? What's their ability? What's their ability to speak, or do they want to have a chat with me, quite honestly? And from there, I'm going to work that out. And it quite often is, for me as an orthoptist, vision is maybe the second or third test I do. I'll do other tests first with the child, like looking at their convergence, which is bringing things in towards their nose, or maybe even their 3D. But what I want to do, particularly with children under the age of 4, is I want to spend that little bit more time getting their trust, making sure that they're not too worried or scared about what we're going to do. And that also gives me the opportunity to find out, by having a little chat with them, what their language level is. So I think it is often the case where we might ask them to do a test where it's a little bit too tricky for them. But if I can gauge a little bit beforehand, I might pick the perfect test first time. Yeah. And that building up of that rapport, that's one of the things orthoptists do really, really well.
Fantastic.
Cover testing, really interesting little tests that we do, very simple. It involves covering an eye, uncovering it, switching around, looking at the other side. Doesn't sound too interesting, really. But from that test, we can actually find a huge amount out about how the eye is positioned, not just in the obvious sense when you look at someone, but also when their eyes closed. Do they want to turn? Do they want to pull outwards? And that information helps guide us to understand if a parent is worried about position, but their eyes look straight when they walk in the room. That's why we can still find out exactly what's going on. And that's where we get our toys and our tricks and our little fixation targets out. One of the first things I did as an orthoptist all the way back in 2005 was start to develop this little pencil case of things. And all of those little toys, it doesn't sound like a lot, but I need that attention. I need that child for those few seconds to be really with me. And that's what a cover test is about. So when you see us get these funny toys out, know that we're just trying to find a way to interest your child whilst also helping them feel as safe as possible whilst we're going through these slightly unusual tests.
Very good. Okay, so if a parent wanted to explore the possibility of seeing an orthoptist, how would they go about doing that?
Well, there's a few different ways, and it does depend a little bit on where you're located in Australia, but let me just give you a basic summary. So most orthoptists working in Australia work under an ophthalmologist within an ophthalmology practice or within a public hospital system. So you wouldn't in those cases get referred necessarily to the orthoptist directly. You'd be referred to the ophthalmologist who would arrange for you to see the orthoptist as part of their pre-assessments and work through. However, we now know, particularly with the NDIS and the development of the services around that, it's increasingly common to find orthoptists working either independently or within an eye clinic where you can actually access them. So the first place I'd start realistically is actually either Google or White Pages, because most people are going to be in one of those two forums and easily accessible. Also really key to remember that orthoptists have different areas of specialty. So for me, I mainly work with children and adults with double vision and adults who've had strokes and things like that. So I have a sort of niche area that I deal with. So what you don't want to do is inadvertently see an orthoptist who's maybe specializing in an area like low vision if you're looking for someone who's pediatrically inclined. So I would recommend a good Google search, a little bit of an email before you book anything, and make sure you ask the questions that are really pertinent to you. What are you looking for from seeing an orthoptist? Because sometimes it is better to see them with the ophthalmologist, but there are times where we can provide help and support when we're standalone doing our own thing.
Excellent. So Nat, what do you think is the greatest benefit of having an orthoptist as part of your child's vision team?
Well, obviously I'm biased. Let me start there. So I just think having an orthoptist as part of that eye team working for your child, making sure we get the best possible outcome, I just think it's because it all works together so well that the children get the best outcomes. Me as an orthoptist, I spend my time finding the best styles of glasses, the best eye patches, you know, parent has a problem in this particular area, or the child's really struggling with this particular task at home. That's where I've got knowledge that I can really add into a child's treatment plan. Of course, my role is to be clinical. My role is to make sure that you're getting the right tests at the right time and the doctor's happy with those. But also think of an orthoptist as the linking point. I'm the bridge potentially between yourself as a parent who has a really difficult question that maybe they've asked the doctor before and they really didn't quite understand the answer. I can potentially answer the question because I've worked with that ophthalmologist for years. I know them inside and out to some extent. I know how they manage things and how they do things. So I might be able to help. Or if I can't help, I'm more than comfortable going into that ophthalmologist to say, you know, parent of so-and-so is just a little confused on this area. Would you be able to spend a few minutes?
Yeah.
And that really knits together the parent and the doctor working together along with the orthoptist. And optometrists can also play a great role in this. You know, nurses, the admin team, it's not just one person. Obviously for World Orthoptic Day, I'm pro orthoptics big time. But I think the thing about children's eye care is it's a team effort. And the children that get really great outcomes often have that really good team around them. So the orthoptist fills that middle role, that little bridge.
And finally, what will you be doing to celebrate World Orthoptics Day?
Well, I'm proud to say it's the 4th anniversary of Adelaide Orthoptics opening. So I do think I might be having a cheeky glass of wine with my colleague who opened the practice with me. So World Orthoptics Day is extra special for me.
Excellent. Well done. Natalie, thank you so much for spending the time with us today to go through the role of an orthoptist and how they can benefit our children and also other people in the community. And I do hope that you have a wonderful time celebrating World Orthoptics Day on Monday the 7th of June. For anyone out there that would like more information on Adelaide Orthoptics, you can go to adelaideorthoptics.com.au. And for more information on child's vision, health and safety, you can head to kidseyegear.com.au. Thank you so much, Natalie.
Thank you for having me. I really appreciate it.
You're welcome.